Well, tummy tuck is a big surgery that can be both necessary, both cosmetic and both functional, because usually the patient who submits to tummy tuck is a patient has lost weight, has had pregnancies, so it has a lot of redundant skin, relaxed skin, and soft tissue under the skin, subcutaneous soft tissues. In that case, the cosmetic fat is that they don't want to see them like that. They don't like how they look like when they are wearing a dress or something, which can show all the curves which are not regular. On the other side, there is also the problem that sometimes, especially in patients with post-pregnancies, have an enlargement of the midline, a so-called diastasis of the muscles, rectus muscles, which don't give a flat profile and can also allow the sort of pseudo herniation of the intra-abdominal tissues. It's not a real hernia, but they can see when they do an effort that there is a kind of a bulging of the tissue. And this is can be cosmetic, but can be also functional, because the tightening of the muscles many times improves the back, which sometimes is painful, but with the tightening of the muscles, the back, I see that gets better, and many patients are happy because they feel pain anymore. The other occasion is when there is a massive fat loss, weight loss in post-bariatric patients who have really a lot of tissue because they lost maybe 50, 60 kilos or more. And so they have all the skin is relaxed, starting from the breast, from the tummy, from the legs, the arms, and everything. And in that case, of course, is also part of the medical treatment that they did against obesity. So it's the final step after the bariatric surgery, or anyway, a strong diet where massive weight loss has been. The side effects, say, of this are a scar, which is a long scar from side to side, like the cesarean, but longer, and another scar inside the belly button, which, of course, especially the horizontal scar is more visible for a longer time, then it becomes white. And while the round scar, the belly button, sometimes is less visible. But of course, they are scars. Many people the patients who have had weight loss don't care about that, because they want to get rid of all the excess tissue, and sometimes also say, I don't care about the scar, I will do a tattoo on top of it or something like that. So we can say that yes, sometimes also in patients who have to undergo to a tummy tuck have also real hernias, umbilical hernias, or anyway abdominal hernias that have to be correct, repaired, or they can have also the muscular fascia with some interruptions because it's too weak, or so this is also more functional, more medical. Then, it usually is not so painful, but it gives a big discomfort because it's a big surgery. Is a wide area that it has to be treated. So at the beginning, the patient has to stay a little bit bent in front, Usually after a few days, they don't remember that and they stay normal straight. But let's say that it takes at least two weeks to recover properly. Even if they have to care about the skull, about the belly button, about everything for longer time, for 1 month or 6 weeks, wearing a compressive garment, avoiding efforts with the muscles, avoiding any gym or something, or things that move too much the muscles, because this can be painful. And also when there is the suture to of the midline, the approximation of the muscles, this also sometimes the upper part over the belly button can be a little bit painful, but it's not a real pain, it's just a discomfort. What can happen is sometimes it can come a seroma, which is some liquid underneath the skin and the fat in the skin and fat layer. Due to the trauma, due to some interruptions of lymphatic vessels, even if the actual techniques are more take more care about these problems, so you don't undermine the areas where you know that there are more lymphatic vessels which can give this problem. But sometimes if there is a lot of tissue to remove, this can happen. And another thing important to know is that if you have a big amount of fat, the layer of fat that remains is big, there can be also delayed healing, because the fat goes on becoming liquid and tries to come out, finding the way on the scar that has been just done. So it's very important to know that it's not a way to lose weight or to become thin, but it's just a way to reshape, like with liposuction, to reshape the body and remove what in excess that has become, remains relaxed or loose. Another thing also, after the surgery, there is usually there are some drains that will remain for 1 or 2 days, depending on the case, and then will be removed without problems. Yeah, in a certain sense, yes, in a certain way, because you remove what is in excess, and this doesn't come back. Of course, if the patient doesn't, after that, doesn't take care, goes on with a incorrect way of life or way of eating or something, they will increase in weight, become fat again, and maybe they will not be like before, but for sure they will destroy the job of the surgery. Well, if the stretch marks, like very often, are in the inferior part of the tummy, let's say from the belly button into the scar, so are included in the area that will be removed, of course, they will go back, they will go away. But if there are some other stretch marks are over the belly button or in the area that is not removed, you cannot do anything. It's not a treatment for the stretch